Thanks, Anne-Marie. So, good afternoon, everybody. We're just going to sort of give a professional and the public view of how we can get across how embedded your involvement is in your application form.
So we thought we'd introduce who we were first. I'm Una. My main job is as a mum. I'm told I'm also a carer because I've got an adult son who's 20. He's autistic and he lives with severe anxiety and mental health problems. As part of my introduction, I'm going to use it as a learning tool as well. I don't particularly identify as a carer, and we'll come on to who we're talking about when we're talking about patient and public involvement later, but you have to think about how people identify as individuals. I've worked in the voluntary sector most of my adult working life. Got a lot of experience with volunteers and running small organisations and service development. I've been involved as a public contributor since 2003, which is a long time ago now. I always take a deep breath when I say that. And this is another learning point, really. I got involved by accident. I had no idea that this world existed until I responded to an advert for something that spoke to me. And it spoke to me because it was about being a new parent, producing information for parents about the heel prick test. So there's something about people don't know unless you ask them to get involved. Since 2003, a lot of the public contributor work I've done has been with NIHR. I've been involved with Involve, or now Centre for Engagement and Dissemination. I've done an awful lot of funding panels as a public member, or committees I think we're supposed to call them now, over the years. I've had a lot of strategic and governance roles, including currently as a public member of what they're calling now, I think, Public Partnerships Programme Board, which is another learning point. The terminology changes a lot. Don't get caught up in the semantics and the literalness of terminology. Think beyond and underneath what that means. I've been involved in a lot of PPI development, including the UK standards for public involvements alongside Paula, plain English summary stuff that was done for NIHR, PPI in the standard application form, those sorts of things. And I'm also involved locally with the ARC and the BRC. On top of that, I get involved in research projects around autism because it's obviously an area of interest for me. I've been on advisory groups as a parent. I've co-authored things. I'm currently a co-applicant on a study. And I think that there's another learning point here. When I'm involved in those studies about autism, I wear my heart on my sleeve, and it can be an emotional and traumatic experience sometimes because you relive difficult times for your family. Today, I'm here as a pseudo-professional, so hopefully we won't have the tears that you sometimes get in those other things. But it's about being clear that the experience for public contributors can vary from person to person and can vary from opportunity to opportunity, and it's about being mindful about that.
Thanks. And as Anne-Marie said, I was a researcher first and foremost, but have moved and worked in public involvement for over 10 years within NIHR, and am now senior manager at one of the Applied Research Collaborations. And it's really good to now be embedding the public involvement and providing the support for that activity. I'm also a mum of children with very rare conditions, which opens up a whole new area of dialogue within research. But also, I'm a patient and took part and benefited massively from being a participant in a research study. So we all wear multiple hats, but we're all members of the public. So as Una mentioned, we both were very involved with the development of the UK standards for public involvement. They were brought about because people didn't know what good looked like for involvement. And we wanted to build something that wasn't going to be a robust sort of recipe book if you do this for your involvement. It was to encourage people to reflect on their practices. Each of the standards provide prompts to think about who your audience is and how you're going to reach them, what support they're going to need, have you embedded it in your governance processes and all of those. And the idea was you can reflect on what you're doing and strive to improve that. I want a PhD student who's never talked to a patient to actually go out and find out what their perspectives on their piece of research are going to be. That's the start of that journey. That's going to evolve and develop, and it's all dependent on your resources and lots of external factors too. We'll come back to the standards at the very end with hopefully something that will be a really useful resource, not only for the task that everybody here has to do, but when you're considering a project or writing a funding application. So we talked about the terminology and how it's always changing and shifting. Our advice has always been just define what you mean. Most of the world calls this patient engagement, but it's that active partnership. Participation is those we're doing the research to, and engagement is telling them about the research, but also what happened for the research. We want that true partnership. And a cartoon is just something that we're often so focused and too busy to look up and find the different perspective. The answer could be very simple, and it could be right in front of us if we speak to the right people. So why do we involve? There is so much we cannot learn from a book. That lived experience of living with a condition, caring for somebody, or not knowing enough. We talk a lot about public perceptions as well. People don't identify as patients. We're talking about prevention. They need to know why that's so important to them. So we need to learn that. We use this as a valuable resource. It's ethical. The research is about our patients, our population. We need to give them a voice in that. And it's well, certainly for NIHR, it's public taxpayers' money. We really need to be accountable to that and have them shape it. But of course, more pragmatically, you need it to get your funding application taken seriously. It does show, we've had so many arguments about the cost investment in it. We've shown that in the development of a whole oncology drug, you can actually return your investment 500-fold if you do your PPI right, because you'll get better retention to trials. You won't have so many ethical rewrites and those sorts of things.
So we want to talk a little bit about who to involve. And we thought we'd get you to do some work here and tell us who you think we're talking about when we use the term public or PPI or PPIE or lay or whatever we want to call it. Who do you think we're talking about? Just shout out words, descriptions, names, please. Yeah.
With the condition.
Yeah.
Carers.
Yeah.
Can you repeat?
Patients with carers, patients with conditions, I've heard.
Family members.
Family members, yeah.
Everyone.
Everyone, yeah. That's a catch-all. I think the point is, it is lots and lots of different people. Public is a broad term, and we have to remember that people often struggle with public, but you have to remember NIHR is about health, social care and public health. So it applies to all of us in some capacity or other. Potential patients, people who use health and care services, survivors. It's also, as I said earlier, about how people identify. So people might identify as servers, they might identify as service users, they might identify as parents. So it's about thinking broadly about the term, I think, really. And it's complicated because we can all of us, whether we're professionals or non-professionals, identify as potential former or current service users. But we have to remember there is a distinction between a public perspective and a professional perspective. But that doesn't mean, like Paula's self-identifies as both a professional and a patient and a carer. It doesn't mean that her lived experience isn't valid. The point that you have to remember is that when you involve people, whoever they are, what hat they're wearing at that point of involvement and the potential conflicts. It's about remembering those things and being mindful about them. And also, for some research studies, I might not be the end user as a member of the public. It might be your nurses or midwives or GPs. Patients and public might also be important in that, but it's perfectly valid for your public contributors, in inverted commas, to be the people that it's going to impact. So if it's about GP training or nurses' mental health. I mean, COVID's shone a light on that in some ways, around some of the studies around COVID-19 and the impact on health professionals' mental health around it, and doing studies around that. So it's about thinking about your study and who is going to be impacted by it, and therefore who's the relevant people to include in this way. So I think it's also important to remember I'm not representative. I'm here as me and my experience. I may be able to relate to other people's experiences, but I am here as an individual, and you need to think about that in any involvement and who you involve. You know, always, I will say, more than one, because it feels safer for a start as an individual who's going into a professional environment that you might understand nothing about, but also just from all sorts of other perspectives, it's important. You might also want to consider involving individuals because they're important voices, but also maybe organisations, patient-facing organisations who might represent a more representative view, if you want to call it that. I've worked in that sector, and it is an important voice because it often brings together lots of opinions and then synthesises it into a sort of manageable, representative voice. But it's also important to remember there's lots of people who don't join those organisations who also have valid opinions that won't be expressed if you don't talk to them. Okay, so we've talked about who, so where? Where do we find them? Well, we're everywhere, really, aren't we? We're all here. We're all out there. We're everywhere. But some of the places you can go to, if you've heard of People in Research, it's basically a place where you can advertise your opportunities, and some of us will look at it. I have to say I know about it. I've been involved with the organisation that ran it. I look at it maybe once a year. I don't think about it because this isn't my day job. You know, this isn't my day job. Things come to me. People ask me directly. But there's the NIHR research infrastructure that may already have links to with patient groups, and whether it's their own PPI groups or groups that they're connected to in their locality or nationally. There are other national networks. Now, Paula told me about these. I don't really know who they are. I did little more than Google them to make sure she wasn't leading me down a dark alley or anything. But I would expect you to go away and look them up. Equal England, Connecting Communities, Equality Health. Yeah, she's nodding, I got those right. There are community groups, national ones that you might have heard of, like the MS Society, Autistica, Parent Care Forums. I'm dropping that in there because I'm involved with Parent Care Forums and no one's ever heard of them, but I'm telling you about them because they are really important. And there's also local groups that you might know about because of where you live or work or the people that you work with. But you can also approach your local council for voluntary organisation, or there'll be something that's called something like that in your locality. NCVO is the national body that you can go to find out what your local one is. Probably ours in Oxfordshire is called OCVA, which I think is Oxfordshire Council for Voluntary Action or something. But basically they're like an umbrella organisation in your locality. And there are also more informal networks. You know, go and look in when we're allowed to, your library notice board, what's up at your GP surgery. Go and look at community centres, village halls. Look in local village newsletters or put an advert in those. There are people everywhere, schools, support groups, family, friends. Talk to them, talk to people about what's out there. Is that me again? So we're going to talk you through this sort of research cycle, but in relation to an NIHR funding application. As one of the things I do is sit on funding committees, and I do public reviews for grant applications. So I'm going to tell you what I look for. Doesn't mean it's what every public contributor looks for, because we're all individual, but it's generally in that ballpark what people are going to be looking for. So, setting the research agenda. I want to know how you've involved patients or thought about patients when you've thought about what question you're going to ask or what topic you're looking at, and how you've identified and refined the questions that you're asking. It might be that you've looked at I'm going to use abbreviations here on the basis I heard somebody say it earlier, so you might know what I'm talking about. A JLA PSP in the subject area. So there's one in autism that I was involved in, and it's an important source for finding out what's important to not just patients and carers, but also academics and clinicians and so on as well. I want to know if you've been engaging with relevant charities. So if you're doing something about, I don't know, breast cancer, have you spoken to an appropriate breast cancer charity about it? Or you might be doing something more bespoke. You might have recruited public contributors or set up a PPI group. You might have used an umbrella group that exists in your area. What I want to know is how you have involved patients in identifying that question and refining that question. I mean, it might be as simple as you've gone and presented your ideas and then had a conversation with a specialist group of patients about something, you know. But tell me about what that is. So designing the research is pretty similar to what we've just talked about. It's about talking to and working with appropriate public members who can help and guide you to design research that's going to attract the participants you need to take part in order for the study to be successful. One of the things you might consider doing, in addition to the other things, is involving a lay co-applicant. If you do that, think about it. Think about why you're doing it, what the implications are. Are they being paid? I hope they are. How many hours are you expecting them to do? What's the commitment that you want from them? What role are they actually going to undertake? And please, please, please don't say you've got a lay co-applicant who's going to be responsible for making sure people are paid and they've booked the venue and all those administrative things, because they don't have the resource or the I was going to say power, but I do mean power, I guess, to do that, because they don't have access to your internal systems. You need to think about the administrative stuff around it as a separate issue. But expectations are really important, so think about that up front. However you choose to do this with your public partners, please avoid being formulaic. Convince me that you as a group have sat down and thought about what is important for public involvement for this study at this time, in this place, with these people, with this subject and this population. Don't just go, oh, we did it over there for them, so we're going to do the same here. Convince me that you've thought about why this is the right thing for now, for what you're doing here. So, we're going to talk about deciding what we fund. I think that's you next, isn't it?
Yeah.
Seem to have been talking for a long time.
So it's important that we have got the funding committees, and we need to make sure that we can get across all the relevant information in a very short application form. And one of the keys to that is making sure that your public involvement is woven throughout the form. Don't just fill in the PPI section on the form. Think about it from the purpose of what was the rationale for the piece of work, why is it important and to whom, the project plan, your overall project management and the roles of that. Important to include the right costings, and Una's going to say a bit more about that later. But also think beyond that, dissemination. Where's this research going to go? And again, we'll come back to that.
So the plain English summary, this is a really important part of your application. And that's not just public members that it's important for. It's actually a lot of the professionals who sit around a funding committee. It's often where a lot of them start, particularly if it's not their area that they work in. So it's really important. And overall, I'm looking for something that gives me a really good summary of the whole study. It's got to tell me what the question is. It's got to give me an idea of how it's going to be addressed. I mean, quite honestly, I don't need to know anything about your modelling or whether it's an RCT, but I do need to know how you're going to treat participants within it and what you're going to do and how you're going to answer the question. I like to know who's going to be involved in the process, and I like to know, most importantly, what you're going to do when you get to the end of it and you've got your results. How are you going to take it forward? Because otherwise it's all a bit of a pointless exercise. As a non-researcher who's only interested in what you're going to produce really at the end of it. So on top of that, in terms of whether it's a good plain English summary, a lot of this will be in your pack, so I'm just going to talk you through it briefly. Please don't use jargon, abbreviations, like I just did with the JLA, PSP, and technical terms, and avoid overly complicated English or uncommon words. If you do have to use these, and I'm saying if, and it's a big if, please explain what they are. But, you know, I can tell you, you've lost me if you use more than 3 acronyms that I don't know. I can't, it's here. It goes over the top of my head because it's really hard because you keep having to go back to the beginning. What was that again? Which one was that? I don't know what that is. So please be really careful about those things. Keep sentences short. Don't do, we're going to do this, and then we're going to do that, and then we're going to do the other thing, and then we're going to do something else. Because by the time you got to the second or third and, you've forgotten what the first one was, so you have to so you end up rereading everything 3 or 4 times. So break it down into short, sweet, simple sentences. I also need you to think about what it's going to look like on the page. There's something about order. So there's a flow in the narrative, but also something about what it actually visually looks like. If you're faced with a block of text, in small print usually, it's really hard to read if you don't know what the subject matter's about. So use white space, make short paragraphs, use bullet points. People always say it's difficult to do it in these online forms and all that. Well, try, please try, really, really hard, because it makes it so much easier. And actually, if I can get to the end of the plain English summary without having to read it twice, and I've got a really good handle on what you're going to do, I'm going to be a much happier public reviewer when I read the rest of your form and start marking it. And finally, it's really helpful to get other people to read it, particularly your public contributors, a carer, a colleague, your neighbour. Try and find somebody who doesn't know anything about the subject, and they read it, and then get them to tell you what they think you're doing. That might help quite a lot. Because what you'll find with patients who've been involved a lot, and you see it a lot in cancer patients, is they understand the lingo. They understand what you're talking about. And what you need is for other people to understand it as well, newly diagnosed people particularly, to understand what it is that you're saying to them in that plain English summary. And then at the end, please proofread it. There's nothing more annoying if you've got any kind of pedants reading it, if the full stops are in the wrong place, or there's the wrong word, or there's a misspelling. So please proofread it as well. So, sorry, I'm going to be you're going to hear a lot from me here. So, stage 1 application forms. So when I'm looking at that, I'm not looking for chapter and verse about PPI, but I'm looking for a really clear indication that you understand the basics and have thought about PPI when you're doing this. And quite honestly, if PPI is embedded in you as a person in the work that you do, this should be automatic. You shouldn't have to overthink it. You should have a pretty good idea and people that you're working with that will help you to address this. Tell me how you've made sure the subject and questions we've already talked about are important to patients and how patients or the public have informed the plans so far. It's really, really nice when you read, we talked about it with this group or this individual, they said this, and we thought, oh yeah, that's a good idea, and we've changed it. Those things are really important. Give me an idea of what your outline plans for PPI are. You know, at the end of the day, you should have as clear an understanding of what your PPI is going to look like as every other part of your study at this stage. So tell me about what they're doing. If you've considered a lay co-applicant, how patients will influence the research, are they going to be involved, and how are they going to be involved in the study management and governance? I also want to know that you understand some of the key principles and issues, such as whether your participants, your public that are involved are going to need support and what kind of support, how you're going to cost your PPI in a realistic way, something about inclusion and diversity. You know, you need to be across some of the big national issues if you're looking at NIHR funding around PPI, because there's lots of stuff. There's loads of stuff about diversity and inclusion at the moment, and you need to be thinking about that and talking about that in your applications. Stage 2, we're looking for an awful lot more detail here. So I'm going to tell you how I go through a stage 2 application form, so you have some idea of the process that it goes through with a public reviewer. So I'm going to read the plain English summary first, and all those things I said before is what I'm going to be looking at, and what I really need to be able to get from that is a good understanding of what you're going to do and how you're going to do it. You've already got minus points if I don't get enough from that and I have to look at the detailed research plan before I go to the PPI section. So just bear that in mind. So hopefully the plain English summary is really good, and I'm going to go to the PPI section next. And here I'm looking for a sort of bird's eye view with some really clear specific examples of what you mean about what you're doing. I want to know how you've involved people already, so you should know that from the stage 1 if you had to do a stage 1, and how it's changed things. I want to know how you're going forwards going to involve public and patient voices in the work that you do. I want to know how often that's going to happen. So if you say, we're going to we've recruited a co-applicant already, they're going to help us recruit an advisory group, and that advisory group's going to meet every 2 months for 3 hours, and there'll be 10 people on it. That's the kind of narrative I'm looking at. I want to know what those public contributors are going to be doing. Are they going to be helping produce patient-facing information? Are they going to be helping you to design surveys? Are they going to be doing interviews? Are they involved in the governance? Are they analysing data? What's their role in dissemination? Will they be co-authors? Will they present with you? So there's all sorts of different things they can be doing. And you don't need to include absolutely everything, but try and show the sort of depth and breadth of that involvement. I want to know how you're thinking about supporting them. So if you're dealing with parent carers of children who experience life-ending conditions, think about the emotional support that might be needed. If you're going to be working with people with mental health experience and they're going to be you're going to help them to be peer researchers and do some interviewing and analysis, you might want to think about training that's relevant for those things. And I also want to understand how you're going to cost PPI. So put a benchmark in there. Lots of people talk about involved rates. It's now, NIHR rates, I think is probably what we're supposed to be saying. Or you might have a policy in your local team or university or the ARC or wherever it is that you work that you can reference, but just indicate what that is. So I'm thinking, this is great, good plain English summary, good PPI plan. Right, now I'm going to go and look at the rest of the form and see if it's reflected there. Because actually, if it's embedded in what you do, it should be in one way or another. So I'm going to look at the detailed research plan and see if that reflects what you've said. So if you said that you're going to have peer researchers and they're going to be doing this or that or the other thing, or they're going to be, the advisory group's going to do X, Y, or Z, I expect to see some hint of that. You don't have to repeat everything, but some hint of that through your plan. It shows that the PPI isn't just sitting over here by itself. It's embedded the whole way through in everybody's work. I'm going to look at the bit about management and governance. There's usually a paragraph on that. It's amazing how often that you talk about management and governance in the PPI section. It doesn't then get reflected in any way in the management and governance stuff within the actual plan itself. The same with dissemination. If you talk about it in one place, talk about it in the other place. And the other thing is, so if you've got an advisory group or something like that, and you're going to have regular meetings, and you've got a Gantt chart that, I think that's what you call them, isn't it? It's an action plan or something, as far as I'm concerned, in my world. But put it on there, add it in as a line to show that you're thinking about it. It's much harder to forget if you work to, a plan, if you've got it in there, rather than just written in a narrative on an application form. And then the last thing I'm going to do is go and look at your budget to check that your PPI costs are in there and in the right place. It's always annoying when people mix up participation and PPI costs, and they appear in funny places, but I know it's not always the team's fault. That's what I'm told anyway. But I also want to see that what you're putting in actually reflects what you're saying you're doing. So quite often what you find is applications say we're going to have X number of meetings with X number of people paying X amount of money, and that's there. And then they also say, and in between, people will look at this and they'll comment on that, and they'll be at this conference and they'll do this co-authoring. And there's not a whiff of any resource around that. So think about it, and I want to see that you've thought about travel expenses, carers' expenses. You know, if people are coming to all-day meetings, what about refreshments and stuff like that? So just those are the sort of things that I'm looking for throughout the application. And to be honest, red flags are raised when the PPI section is not reflected elsewhere in the application form. You then start to question whether it's actually embedded and whether it will actually happen or not.
So involvement is the key to helping us be more inclusive in our research activities. If we are working with the right audiences, are aware of who our research could benefit, particularly when we're talking about public health research, it's the population as a whole. So we need to make sure that we are involving the right groups that will benefit from the research or potentially benefit from the research. The NIHR has recently strengthened its stance on this, so it is expected in your application form. Good practice is to consider using an equality impact assessment. There is one on the NIHR website to help you just recognise where your research might actually disadvantage a group or unfairly set somebody up. We're very quick to do what's easiest. So people that can read and write English, when actually the population you need to work with are people with very low literacy, people that are hearing impaired. All these sorts of groups means that they'd be excluded at your trial design and your research design, multiple conditions. And each of these, we talk about the protected characteristics, and NIHR also include geographical, so we want to compare suburban and rural areas. We also need to think about access to care and socioeconomic status. But we also, in the back of your mind, you need to know that many of these are all compounding. If people are from a low socioeconomic background with a higher age and have a disability, their outcomes are going to be a lot worse. Our research is often designed in a very sterile way. That's not what the real world is, so we need to move towards that.
So a lot of this shaping research we've covered in the stuff I've said already, but the point I want to reiterate, and it follows on from Paula's point, is about trying to use different ways to involve people to help you shape the research. Some of the things that Paula's talked about already, if you involve a diverse group of people at an early stage, hopefully your research will be designed in such a way that it's accessible to a much broader range of participants. If you think about, young single mums who don't have transport and they have to go Humpty Dumpty miles to get to wherever it is that you want them to participate, that might not be the most appropriate way to do it. But if you involve a broad range of people in ways that work for them, you might get a better design. And when I say that, it's about thinking about, you hear a lot about advisory groups and meetings and focus groups and stuff like that, which are all very good. But actually, sometimes you have to think more creatively about how you involve people in doing these things. Some people are happy to do polls, online polls, or involve themselves in Twitter chats, or are quite happy if you come to a place where they meet regularly anyway and come and talk to them and have a conversation with them as real human beings face to face. But it's about thinking more creatively about how you do that so that you involve a broader range of people. The advisory group and the co-applicant should be the top of your pyramid of involvement, really, and that you reach out to a much broader group to help shape what you're doing and find creative ways to do that work for the population, all of the population you're talking about, not just the ones that can come along and feel comfortable to go along to your meeting in your venue and be surrounded by people who talk a language that they don't talk. And I don't mean that in a English versus French or whatever else language. I mean in terms of the actual language of science and research, as opposed to what a lot of us speak on the street, you know.
So a couple of really quick examples of that is in the previous role I worked with the precursor to the Art, the Clark in the East Midlands, and one of our studies was on health anxiety, and it was really important. We had open meetings every quarter where people could come and find out about the research, but also we could actually identify the issues with the research. So for example, the recruitment was really poor on that one, and actually it was the receptionist in the GP surgery that said, well, you're phoning from a university phone, it will be withheld, these are people with anxiety. You know, the practical solutions, but it also reinforced, the commissioners there said, this is something we need in our toolkit, we don't have a resource for this population. And then what's lovely about this project is the cartoon. Rather than personalising it, they used animation throughout, but that was done by one of the public contributors who'd had a stroke and he struggled to write, but he learned how to draw. So he did all the animations for that project. So remember, your public contributors often come with other skills that could also be beneficial to you. It's sometimes really difficult when the subject matter is sensitive or the stigma associated with it. One of the projects we had was looking at self-harm, and we don't want to make people self-identify that they are actively self-harming, but we used the daughter of one of our public contributors, took study information to her friends at school, who then commented on it and fed back. They had no obligation to identify themselves, but they could ask questions, which they did. They reinforced that the research was very needed, but they said the recruitment strategy was never going to work. It changed. They advised us how to change that. It changed it, and recruitment went up. So it's really good. And vignettes are another way to do that, to help people. You create a character. Particularly clinicians understand what their patients often go through, and we know from anecdotes. But you can use that to build, and then people can reflect without identifying, yeah, I would do this. They can use, oh, John would have done that. So if I was John, I would have. So you don't have to put them in an awkward position. So dissemination of our research. For our researchers, our big endpoint is primarily that high impact peer-reviewed journal article. But actually, that's not what's going to get the population better. It's not going to help put things into practice. On average, it took 17.5 years to get that research evidence from a journal actually benefiting patients. We can't do that. COVID has absolutely shown how quickly we can mobilise things and get them into practice. And one example we had of that is we ran a schools survey to look at the mental health of young people in schools, and it had been running very successfully, but when COVID hit, it was adapted to include understanding about COVID, which was a priority for our public health teams. And we were able to get 19,000 students recruited in less than a month taking part in this. And their young people were also helping us to understand how we could feed back. It was important we fed back not only to those students, their families, the schools, but also the public health teams that wanted the information. And so the young people said, well, you need different ways of disseminating that for different age groups. So you need something in assemblies, you need some homework tasks, you need some games. And now what we're working on is, one of the recommendations was using TikTok to make TikTok films, because the study's still going and the learnings from it are still being embedded into practice. So to keep that population updated, we're designing TikTok videos, and we're also going to use those to raise awareness of research as a whole in a population that aren't often exposed to that.
So I'm just going to follow up on what Paul has said about the importance of making sure reports are accessible to relevant communities. And when I say reports, I don't just mean something written. I'm talking about that in a broad way. It might be animations, it might be comic strips, it might be doing an article in a patient-facing organisation about what you've done. I mean, that's where I read about my research about autism in the National Cystic Society newsletter. It might be radio, it might be a podcast, it might be, you know, whole range of different things. But the importance is that it has to be accessible to your community that you're working with, because it will help them mobilise that information. So I worked in a patient-facing organisation for dystonia for a long time, and our patients scoured it's a rare condition, not known by many people, scoured the internet and everywhere for information about latest developments, and would take that to their GP and say, this is what you need to be looking, find this for me. And that's what mobilised it meant that they got diagnosis went down much more quickly once we were able to sort of get that to people in a safe and reliable way. So it's really important. And a plain language summary or plain English summary, whatever you want to call it, is important. There are lots of plain language summary templates available out there. Go and look for them. Look at different ways to get the information out there.
Yeah, and one of the key organisations to help you embed your research into practice is the academic health science networks that are across the country, and they are already sort of working with the NHS and the community groups to make sure that research is put into practice. Very conscious of time, so speeding up, nearly there. So one thing we need to be mindful of is considering in your application what impacts you want your piece of research to have and on whom. We want your public involvement to shape the research, but it will also shape you, it will shape the contributors, and a lot of the time it also shapes the wider communities, particularly where you're giving reliable information that they take back to their communities. But again, it's about not picking the methods to identify your impacts as too rigid. So the most significant change technique is really fluid, and it helps you understand what's been the most significant change since you were on that medication, since you took part in that study. And you can really capture it without making any assumptions as to what the impacts might be. So here's a list of resources. The slides will be available afterwards, but there are an awful lot out there.
So we just really like to say, learn from what you've done and what others have done, reflect on what you've done, be brave, try new things. This isn't an exact science. Sometimes it won't work, but it's always worth trying, and transparency and honesty with the community that you work with is important, but reflect, be brave, and try new things, please.
So, and apologies, I always use this sign in my presentations because I think it's important that we take that step. We need to take that step back from our research. We get too embedded in it, and our public contributors really help us do that. And they bring into focus what's the most important thing. And on this sign, it's the small print at the bottom, which you can't read, that says, "And the bridge is out ahead." You know, that's the critical thing. That is a genuine sign from Australia. So I'll do that. So we're just leaving you this as a really hopefully helpful resource for you all when you're planning your projects, when you're thinking about your application process, using the 6 standards as a framework to prompt you. Who are you going to involve? How are you going to find them? And what you need in place. So we just hope that's a useful resource. Thank you.
Wonderful. Thank you so much. Really important and useful information. We are going to turn into pumpkins apparently at 4:30. This is our brave new world for the poor people online. So we have an opportunity just for 1 or 2 questions, okay. But we'll need to finish at 4:30.
Okay, brilliant. So there's more and more interest in PPI as well as co-production. Interestingly, the discussion about this always seems to assume that the researcher doesn't have personal experience that is valuable. So it's really interesting to hear that Paula has had different roles. But building on your comments about this, I wanted to ask whether a person can only wear one hat at a time. Thank you.
Well, from my own experience, I was a public contributor with the board. And even though I was going in fully informed, supporting people to do that, when I was on the other end of that table, faced with lots of consultants, I really struggled to speak. And I've not been alone in that experience. So it is, yeah, I think it is, but it's then down to the group and the support that you get to show that your role, what's your purpose in that meeting, and really clarify that.
Okay, if I can go for another one. So their university has great PPI groups. For fellowship or grant applications, does the NIHR think that it's okay to work with existing PPI groups rather than setting up new ones? I ask because I've been told it's preferred if researchers set up their own group, but this seems to be a less efficient use of resources if groups already exist.
I think, I'll answer that if you want. I think it depends. So I've seen grant applications more recently where it feels like PPI is being outsourced to those groups, whether it's within the university or is part of a charity. And I then question that because it's important for the researchers to be connected to the public voice, I think. So it's not a blanket, no, that's not okay. I mean, it's perfectly reasonable in the early stages to use that as a sounding board. But I think there's something about developing personal relationships that's often missed out. So it's not necessarily doing something new. It's about how you work with what's there.
Can I also come in very briefly on that one? And actually what we were trying to sort of move away from, and that's why me changing my roles has been really helpful to do that, is to build a sustainable relationship using the community voluntary sector organisations to have access to all the communities, but for them to have access to us. So we're not creating a group specifically for one project. You have that dialogue and you have that mechanism, and that's sustainable beyond the project, because actually if people get dropped at the end of a project because the research has gone in a different direction, that will make them hesitant about taking part again. So we need to be changing the way we do it.
Really, one of the most entertaining PPI experiences I had is when our musculoskeletal group, which tends to be quite a certain demographic, as in retired women, were asked to speak on maternal health services. They provided some pretty out-of-date information. So thank you so much. We're not going to take questions from the audience because you will have the opportunity to ask Paula and Una questions as we go. So thank you.